What is fine needle aspiration for lymphoma diagnosis? Imagine a tiny needle that can help doctors peek inside your lymph nodes without needing surgery. That's what fine needle aspiration is all about. It's a quick, minimally invasive way to collect cells from a swollen lymph node that might be linked to lymphoma. The procedure involves inserting a very thin, hollow needle through the skin into the lymph node. Sometimes, doctors use imaging tools like ultrasound or CT scans to guide the needle, especially if the lymph node is deep inside the body. Once the needle is in place, they gently pull back to withdraw a small sample of cells. This sample is made up of scattered cells, not a piece of tissue, so it doesn't keep the original structure of the lymph node intact. Fine needle aspiration is often used as an initial test to evaluate swollen lymph nodes, known as lymphadenopathy. It can give doctors a quick idea if lymphoma or another condition might be involved. Because it's less invasive than surgical biopsy, it's especially helpful for patients who need a fast assessment or have health issues that make surgery risky. However, since the sample only contains individual cells and not the full tissue architecture, it can't usually provide a definitive diagnosis or tell the exact subtype of lymphoma on its own. For more detailed information, doctors often perform additional tests on the aspirated cells. These include flow cytometry, which looks at cell markers, immunophenotyping, and molecular studies that analyze genetic features. These tests help identify specific types of lymphoma and guide treatment decisions. Despite these advanced techniques, a fine needle aspiration alone often isn't enough for a full diagnosis. Usually, if lymphoma is suspected or needs classification, a more comprehensive procedure called an excisional biopsy is performed. This involves removing an entire lymph node or a larger tissue sample, which preserves the tissue's structure and allows for a more accurate diagnosis. In summary, fine needle aspiration for lymphoma diagnosis is a useful, quick, and less invasive way to get a sample from a suspicious lymph node. It provides valuable early clues but is generally part of a broader diagnostic process that includes tissue biopsies for a complete picture. Always remember, if you have concerns about lymph nodes or lymphoma, it's essential to consult with healthcare professionals who can recommend the best approach tailored to your specific situation.